Statistics released by the Electronic Tuberculosis Register indicate that 70% of patients suffering from tuberculosis in South Africa are co-infected with HIV, highlighting the critical importance of dual testing and treatment for those with both HIV/AIDS and TB, particularly in light of World AIDS Day that kicked off yesterday. HIV leads to a defect in the immunity system of the patient, which results in an increased risk of contracting tuberculosis. Therefore, early diagnosis and treatment of these co-infectious diseases is key to avoiding long-term complications and even death. The Department of Health has made a concerted effort to make both HIV and TB testing easily accessible for all South Africans at public health clinics across the country. Now, Dr. Dominic Stott, who is the Executive Medical Standards and Services at PPS, joins us in the studio today. Very good morning to you, Dr. Stott. Thank you for joining us again. Just quickly, if you can maybe put it in sort of layman's terms, the correlation between this dual infection between HIV and TB.
The HIV, as you quite rightly said, causes a decrease in the immunity. A large number of people in South Africa walk around with a latent TB infection anyway. Most people actually do, because we were brought up with TB, but our bodies coped with it at the time. What happens when one becomes infected with HIV is that your body can't cope with that latent infection. It becomes reinfected, and therefore you show active TB. And it's that active TB together with the HIV that has long-term serious implications for your health. And that is at that point where active TB treatment should be implemented. And it's at that point where you're in great danger of morbidity and mortality unless it is implemented.
The importance of effectively dealing with the co-infection.
Well, you have a 37% times increased chance of getting a reinfection of TB if you have HIV. So that indicates how important it is that you are tested for TB and then treated for TB. Whether you're HIV positive or not actually makes no difference. So really, the emphasis should be around the testing for it, together with the testing for HIV, which goes on anyway, and our Department of Health has done wonderful work in doing that. I mean, the figures are available everywhere, how many millions of people have been tested for HIV. The point of care testing, which is available for HIV, has done wonders. We now need to have a widely available point of care testing available for TB, which will have the same results, and implement TB treatment, because if we don't, we then lead ourselves down the route of a TB form like MDR or XDR TB, which is much more difficult to treat, much more deadly.
You talk about the wonderful work that the department has done in getting testing out there.
Yes.
But do South Africans understand the importance of testing, and how have they responded to this?
I think there's still a lot of stigma attached to being tested. But the antenatal clinics have done wonderful work in getting every woman who goes there tested for HIV and implementing treatment should it be necessary. South Africans don't necessarily realize how much in the forefront of HIV research South Africa actually is. The recent Melbourne HIV conference, which was in August that I attended, it really put it out there how much in the forefront South Africa actually is. And we can be very proud of the work that has been done by our researchers here.
Finally, I want to talk about education and then curability of tuberculosis, because I'm not always sure that people are aware that this is really a curable disease.
Absolutely. TB, whether you have HIV or not, is 95% curable. You've just got to take the tablets. That's why the DOTS program was implemented, where the nurse actually watches you take the tablets. Provided you take the tablets for the 6-month period, you can be reasonably sure, 95% sure, that you will be completely cured. If you interrupt that treatment program you then allow the disease, the TB, to recur, and it may cause a type of TB which is a lot more resistant, which can then be passed on to a whole lot of other people and lead to, hopefully not, but possibly an epidemic of a resistant form of TB for which fewer drugs are widely available and much more expensive to treat.
Always much more
Always.
expensive, unfortunately.
Yeah.
Well, Dr. Stott, thank you for joining us this morning.
Thank you.
Well, that's Dr. Dominique Stott, who's the Executive Medical Standards and Services at PPS, talking about the scourge that is TB, and it always seemed, well, more than 60% of the time, connected with HIV.